live. Okay, I think we're live. We're probably live. I don't know if we're live. Hello. I hope that I'll show up. You will show up. We will show up on my phone. We'll see here. Karen is live now. Hello, hi OAC. My name is Karen Boyti and I am part of the Ontario Autism Coalition. I'm also a member of our board of directors, and from time to time we host Facebook Lives to talk about the issues that we debate, that we look at, that we discuss on our page. So tonight, our theme, what is it like to run a behavioral intervention center rooted in the principles of ABA, Applied Behavioral Analysis? With me this evening are Tracie Lindblad. Hi, Tracie. Welcome back.
Hello. Thank you.
And Lolly Herman. Hi, Lolly.
Hi.
Each of these women have worn many hats as educators, therapists, businesswomen, and let's not forget, moms. I will post their credentials at the end of this conversation. They're pretty long, so we'll just move on. We hope to cover a lot of ground tonight. So, as I mentioned, I'll skip the lengthy introductions and I'll let you get to know each person through the course of this conversation. Both of these women have run what we can refer to as private ABA centers. Now, that's a pretty tricky distinction in this very complex universe that these two women navigate. We'll try to unpack some of this systemic distinctions if we can, but my primary focus tonight is to find out what these women actually do. What the heck do these women do? Please feel free to make comments as we pose questions, and I'll do my best to incorporate your thoughts into the conversation. Okay, so here we go. Ready? That's your cue. You guys ready?
Yes.
Ready,
Yes.
ready.
Tracie.
Dun, dun, dun.
Dun, dun, dun. First question, tick, 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 tick. You have a very long history with autism services in the province of Ontario. Can you quickly describe the difference between regional providers and small providers like the services that Lolly runs, for example? How is it that DFOs came to be, and why do we call them private centers, but most of the money that families use come from the province? So how does that work? That's a big question.
That is a big question.
Yeah.
And it's complex and it's changed, over the years. So over the last 20, 21 years, all of that has changed too, and continues to evolve. So at this point in time, right now, you have basically two types of services. There are the DSO, which are government funded services. So those are regional programs, and there's 9 of them in the province with subcontracted agencies as well attached to some of them. So you don't even really know sometimes what type of a center you're going to, whether it's fully private, whether it's partly government funded, or whether it's wholly government funded for autism services. But the government funded regional programs directly get the money, or in the past got the money directly from the government. They didn't have to apply, child by child. They didn't have to depend on parents coming to them with the funding. They were actually funded directly by the government and had base funding every year and didn't have to meet the billing caps and didn't have to meet all the things that private providers do to run a business. So that's the regional programs. And typically they're much larger agencies. Think of Surrey Place Centre in Toronto, or Erin Oak, or Kinark, or Ron Joyce in Hamilton. They're large companies, large agencies with 10s and 20s and 30 behavior analysts and sometimes upwards of 100 ABA therapists. And then what happened was the government started the OAP that way, but that wasn't enough capacity. And so they always knew that all the private behavior analysts out there who, some of them work out of their home and only see children in their homes. Some of them have small centers that, may have 2 or 3 behavior analysts. And then there are a couple large centers in the province where there's 30, 40 behavior analysts between different, clinics or centers in different areas. And they're managed, it's all private. Some of them are not for profit and some of them are for profit. So there's these 3 really different types of service agencies or service providers. And so it's pretty complex for parents to try and figure out, who do I go to? What happens with funding? It is slightly changing now because parents are getting the money directly. So even though the services are government funded, they are now taking their money and deciding where they're going to use it. So they can decide to go to one of the regional programs to get services, or they can decide to go to, a sole provider and get services, or to a small agency like Lolly's, and really have a more tailored to whatever fits their family. With the funding, though, still comes requirements and rules and regulations about what you use it for, what you can do with it. The private agencies that are now in Ontario are fully open to do whatever they want as any private business. So it's fully unrestricted in terms of, it's the business owner's decision, how they want to run their business, what they want to offer, who they have working for them, how many people they have, and all those things that go with owning a private business. Just like any speech pathology business or occupational therapy business, it ends up being very similar. Was that answering your question?
It does. But it brings up another question. So if a parent who's new to the scene says, okay, the doctor has told me I need to put my kid into ABA, whatever that is, and now you've just said, well, all centers are different. So is there some kind of standard practice? Like, are they all different? Are there different versions of ABA? How do you differentiate that?
So I can start and Lolly jump in. So ABA is not a therapy. And I think that's the first thing that a lot of people, kind of have a misunderstanding of what ABA is. And when a doctor says you need to go get ABA, ABA is a scientific field. It's like saying you need to go get medical help. So we know the field of medicine is huge. There's all kinds of different branches of it. It's like, what kind of medical help do I need? ABA is a scientific field, and it's got a number of different principles that you can apply, individualized for the child. And it's about what you do with that child, how you change the environment, how you, figure out how that child learns best, how you program for them so that their learning happens and that they can then maintain it and generalize it to other places. And how you do that is not only specific to the child, it actually depends on how the provider, that clinician, has been trained. And so all of us come with different training, and some of us are really really good training, education, and mentorship and experience with children who are what we call non-vocal in behavior terms, but those kids who don't speak. Other providers will not have that training. Some providers are really, really skilled with those kids who are a bit older, who have some mental health issues, have other things going on. Other providers will not be. And so it's kind of like finding that speech pathologist or that physician who specializes in the area that you need. Mm-hmm. So if you think, you have some kind of, autoimmune disorder, you're going to go to a different, you're not going to go see a cardiologist or someone who likes to work with people with heart problems. You need to figure that out.
Lolly's nodding.
Yeah.
What are you thinking, Lolly?
So I totally agree with Tracie that we are a scientific field, and it's the application and the principles that make what we do so effective. And I think what can be so difficult for parents, especially right at the beginning, is you don't really know what your kiddo needs, right? When you walk into a center and you've made your decision, and the clinician does the intake assessment and, let's say, the ABLES or the VB map, an assessment to determine current skill set. strengths, needs, and what we sort of want to focus on as next steps. A parent really, nor does a clinician initially, really know, is this a kiddo who's going to start with a very, focused on DTT, discrete trial teaching, where it's sort of, in my opinion, very rote, or are they going, is the child ready to learn through concepts? And we'd say, okay, maybe we'd use more of a verbal behavior approach, teaching across operants for this student. Or, perhaps this kiddo would really benefit from a little bit of tag teach or precision teaching. All of these are based in the principles of applied behavior analysis. And it really does take a skilled clinician with practice and mentorship to really determine the type of ABA that you are going to apply into your child's therapeutic program. And what's also important, in my opinion, is that you try and find a center where clinicians and staff have training in more than one area, because if we are effective, as we hope to be, and we have a student or a learner who starts off really needing a very, discrete trial program where things are very broken down into very small teachable steps, and then all of a sudden, boom, we have our next learning burst, and we say, okay, this kid's going to get really bored if we don't change this up. His learning profile's changed. So now, in order to help this kiddo, we have to move away from this type of practice and shift into this type of practice. Okay. Now we see that we've taught this child, I'm going to break down what a cross operance means in very, in basic terms. So if my child in kindergarten can look at a picture of a cat, she should also be able to tell me what a cat says, meow. She should be able to tell me that a cat has whiskers, because that's an identifiable, characteristic of a cat. She should be able to sort of walk on all fours like a cat. She should be able to draw some sort of picture that resembles a cat, or to her symbolizes a cat. So, and that is where we're saying, okay, so yes, this is a picture of a cat, and you understand the category of the cat, and you understand what a cat does, and all of the different functions, features, class, all of that wonderful stuff. Well, now what are we going to do? Let's put together a little bit of a play script around feeding a cat and being a cat. And that shows us that, this learner is flexible enough to learn across these various operants. And as a clinician, that enables us to say, okay, how am I going to take all of these pieces and put it into a program that motivates this kiddo to maintain attention?
Lolly, I've heard you use the term learners a lot, and we in the parent community call what you do therapy. What's the difference? Are you therapists, or are you instructors? Are you teachers?
So I'm a teacher and a therapist, no, by trade, but no. So I believe that we are all learners, right?
Mhm.
I'm a learner, you're a learner, your kiddo's a learner, my dad's a learner. I think that we're all learners. I think that the way that sort of our province or our government sort of says, here's who allocates, here's where you get the funding from. It's not under the Ministry of Health. It's not under the Ministry of Education. It's under, I think it makes it very difficult for parents to really to understand who we are. We are therapists, and we are providing a very specific therapy or science to teach your child who requires a very specific way to learn new skills. So when I was teaching in a classroom, you know, or for example, when I was in teachers college, what did I learn about working with a child on the spectrum? Very little, this much exactly. I happened to have already been in the field at the time, so I was able to flip the coin a little bit in my teaching program, and I actually taught my cohort about autism. I did a whole course for my cohort on autism. And so if we look at an Ontario certified teacher and them or him or her going to university and learning about accommodations, modifications, you know, individualized education plans, and what do I do during my prep time, and how do I follow the Ontario curriculum guide? The curriculum is there, and the teachers can determine how they're going to use their strengths to teach. In our world,
You're still here.
I am. Where'd I
You're
go?
still here.
Okay,
I don't know.
In our world, our staff need to be taught. I mean, our training manual is thick and detailed. They need to be taught step by step by step how to interact with this specific learner in order to achieve skill development. So, you know, having those two hats, it's actually been wonderful, because you know, when I'm transitioning a student into the school board or a private school or what have you, or when we collaborate with a larger team, if a child is in school and in therapy, it's really nice because I can say, from a teacher's perspective, I understand, and this is what you can do in the classroom, right? You cannot do what our therapists do in a one-to-one setting, in a two-on-one setting, in a three-on-one setting pre-COVID.
I want to swing back to your staff in a little while, Lolly, but if I can, Tracie, when parents sit down for you for the very first time, what do they want to know about your service, or when you were running a center? What did parents want to know?
Yeah. And I'm still running a center. It just happens to be in London, UK right now.
Yeah.
So,
yeah, I realize that. She's busy.
They,
I'll post her bio. You won't believe it. You know.
I mean, parents want to know. They don't so much. What's really difficult is they don't so much want to know about your actual service. They don't ask a lot of questions about ABA, and maybe because ABA is more known in North America. It's a whole different experience elsewhere. Parents typically have a couple questions. When will my child talk? Will they be able to go to school? Will they be able to be employed when they're older? Will they be able to be married and have children? Those are often the very first questions. And so, you know, it opens up about, well, you know, we're trying to teach your child their first language. And that is unlike teachers and teacher college, because I did my master's of education too. Teachers are not trained how to teach a first language. There are teachers of second language learners. You know, most children that have other disabilities have already acquired some of their first language. Lots of these children, 40 to 50% of individuals on the spectrum, will not gain a functional spoken language. And so our job as behavior analysts and behavior therapists is to actually figure out how we help that learner learn their first language, how they acquire their first words, how they use communication, how they make sense of their visual world, how they use their motor skills, how they imitate people. They have lived in typical environments and have not picked it up.
That's right.
And so it is a unique skill set you need. And it's not one that, even in speech pathology, I had an hour on ASD. And now, I mean, my colleagues at Ron Joyce or McMaster, they've had less than a week on ASD. Physicians, my physician friends, they have one lecture on ASD. So parents who say, my doctor didn't tell me anything, it's because they don't know. They actually don't know. They know how to diagnose because that's what they're taught, they can't keep up with all the literature and therapy and treatments. They're more medical, not an like allied health profession or a therapy profession where that's our job if this is the area that we're in. So parents often, when they ask about services, we guide them. Is that Charlie? We'll
sorry.
guide them. We'll say, look, these are all the things that we know that you need to go ask everybody else. Go look at a number of places. You need to get good information. You need to make a really informed decision, one that's going to work for your child, your family, and you're going to be comfortable. And
let's speed it up a little bit and talk about teams in the center. Lolly, I'm gonna shoot a bunch of questions at you because we're already a half an hour in. So how many people are on a team, and how do you match instructors with kids? How do staff receive instructions from you or their immediate supervisors? And how do they greet kids?
How does it work? So let's talk about a child in full-time service.
Yes.
So a child who is with us full-time will typically have between 4 or 5 instructor therapists, 1 senior therapist. So instructor therapists, senior therapists are scheduled, instructor therapists work with your child daily. Senior therapists work with your child a few times a week and then oversee your program, your child's program, other points during the week when they have their senior therapy off the floor time. We have a BCBA or a clinical psychologist. We happen to have both at our center. So most are overseen by our clinical psychologist and some are overseen by one of our BCBAs. And most importantly, our parents. So the parents, the therapists, the senior therapist, the clinician in charge, and if a child has any outside services, speech and language, occupational therapy, in normal times, they can come into the center and do sessions with our staff. Right now, we're doing that through Zoom. And then, of course, if, we're talking about full-time, so that child would be in school. So, yeah. So 5, 6, 7, 8, between 8 to 10 people.
On a team.
On a team.
And
how do...
Yeah. How in a given day, let me back up a little bit. Can you describe your clients? Who are your clients?
So the majority of my clients do have a diagnosis of autism, but certainly not all. I think, ABA is just really good teaching. So we work with kiddos with various exceptionalities in our center, in schools, in home, in the community. And the clients who are with us full time are typically clients who really need the level of expertise that our team can provide because their parents did not see gains in a more traditional setting. And so they will come to us full time and we will work on the prerequisite skills needed for integration into a sort of a more mainstream environment. Knowing that funding or therapy and funding for therapy is not forever. So we need to make sure that as part of our plan, we have that transition into the next learning environment put into play quite early to make sure that we're embedding all of those targets into programming.
And how are parental wishes passed on to you and the staff? Excuse me, I'm going to kick my kid out of the room. Go ahead.
Okay.
Charlie, you need to go to another room and play.
I can't talk over her.
Yeah, I know.
I can't do it.
Go on, off you go.
I'm so sorry, but he's having a good time behind me.
Listen, I have to say, my 3 kids have been superstars. Nobody's even passed me yet.
Yeah.
So
your kids are so perfect.
Great. We have a serious project going on for respect in my house right now. Anyhow, so listen, there's one thing I wanted to be in life, and that's a mom. And owning and operating this center has been a tremendous gift and really a dream. And from day one, I can only speak for myself. And I'm not saying that this is the only way or the best way. This is just my way. We have always been open door. I believe in family. I believe in community. And I think that it's so important to bring the family into the picture right at the beginning, and not just to listen to as a talking head, but to really get to know, what are your beliefs? What does home look like? What are your stressors? What are there religious beliefs that I need to know of, you know? So to ensure that, like, you know, if you're in your religion, you don't believe in superheroes, well, I need to know that so that I don't embed that into your child's program accidentally. Or I let you know that we're having a dress up day. Would you like your child to participate? You know, at the center, what have you. With COVID, we've had to become closed door for the first time in 20 years. And we found ways. We do daily communication, emails, pictures and videos that get sent out to our families to make them feel like they're in the center as much as we possibly can. Our staff and administrators are outside in the morning greeting, making sure that if families need a little bit more time, there's extra staff there to hear them out. There's some time to chat at the end of the day. We make sure we try to not book our staff back to back so that there is a little bit of that time. Our short period when we were not in center and online, we opened up our Instagram page in a way that we never had before, just to try and keep connected to our families. I think that there's something so important about trying your best to develop a really true, honest connection with your family so that you understand the bigger picture. Did I answer that question?
Yes, you did. Tracie, on the other side of that, what do you need from a parent? What kind of information helps you get a program together well or efficiently, effectively?
Priorities, like Lolly said, priorities for their family, because every family is different. So we've had some families that say, I can't cope with toilet training. I can't cope with the messes. I'm going to lose it. I don't have time. Do that. Other families will say, oh, that's the last thing on my list. That's not bothering me at all. I need them to sit and eat because that's important in our family. Or, you know, or there's a family where it's either a blended family and there's multiple siblings and multiple challenges, or multi-generational family and they have multiple languages being spoken in the home. And so you have to take some of those into consideration as well. And really it's because every family is different and the dynamics are different and the stressors are different. It's really important to remember that when you have their child and you're trying to work with them. You know, and I think, Karen, I've told you when I was a young speech pathologist, you know, I was pretty critical of parents before I had my own. Like I would give them a little articulation homework and they would come back the next week and it was not done. And I actually was very upset until I had my own children. And that's your best teacher, right? That, oh yeah, it isn't that easy at home. And best intentions aside, sometimes you can't get things done. And so that's, you know, really important, I think, especially because a lot of our staff are really young individuals. So a lot of them have not even lived on their own any longer because it's so expensive, you know, where many of us live. So they've still lived at home. They haven't lived on their own. They don't, you know, a lot of them haven't even had a lot of experience with young children. So not little nieces and nephews that they've babysat. Like culture is changing, our environment is changing. And so it's really important to, you know, for us to really teach them and bring them along and really model that, you know, criticism isn't helpful. Like the reality is, you know, we're trying to help this family cope. And the other reality of ABA services, unfortunately, is it is extremely expensive.
Yeah.
And so
Yeah.
you have families that are under such incredible stress trying to afford a couple years to see how far their child can get. And it weighs on you. I mean, it weighs on me for sure. As a
Yes.
therapist, as a business owner, we have an incredible amount of stress to do the best we can for that child in
Yes.
the period of time we have them.
I was wondering about that today. I was wondering about asking you both about, do you feel the enormity of the task that has been put in front of you? I am personally very aware of this strange experience of sharing far more of my life than I ever really intended to or would like to share with my child's provider. And as you mentioned, with these very young childless people who seem to be able to get more out of my son than I ever could. And it's a little blow to the ego, let me tell you. But do you feel that? Do you feel this vast responsibility of holding a family story in order to wrap support? If you were wrapping supports around a child, that means you're wrapping support around an entire family. Is that
feel the
daunting?
enormity. Yeah,
Yeah.
I feel so. It's the enormity. The feeling is not for me attached to the child. It's attached to the family, because I know very much that, no matter how many clients I keep in touch with once they're gone, I only have a child for a short period of time. And my job, in addition, or my job as importantly as making sure this child goes this way, is making sure that the parents go along with them. Because at the end of the day, you are your child's pillar, advocate, mentor, life, everything. And I don't, it's great when you have me. Yeah, I'm a good advocate. Yeah. But what happens when I'm not there? And I want to make sure, and I hear it in my clients every once in a while, I hear a little bit of myself in them. And then I pat myself on the back. The kiddos are the easy part. I want to make sure, right? I want to make sure that our parents are learning along with us, because it's when your kiddo's 20 and 30 and 16 and 14 that all of these things are going to come up, and you're going to be like, okay, wait, I got it. I've got a plan. We're going to break it down into steps. I'm going to bring this person into play. This is what the target goal is going to be. And that's it. It's not going to be easy, but we've got a path. I know how to do this. And we start tomorrow. And that's our job.
You're hoping that parents will walk away from this with a sense of how to manage the rest of their child's schooling.
Schooling will be an uphill battle. It just is. It just is. I do not have a child on the spectrum. I do have a child with significant need. And I don't take for granted the ability that I have to ensure that he receives the services he needs. But I also know how tough it is if it weren't me. And so my job is to make sure that when you go into an IPRC meeting, or when you want to make sure that your kiddo's IEP is updated and that they're following along with the accommodations and modifications that are in that plan, that it's not a stale document that is unchanged for 4 years. That if your kid's learning at a fast pace, that thing can get updated 3 times a year. And that that there's so much to be taught. And that's why for me, you sort of open door and bringing the parents in as part of the team is the path of least resistance. We do not claim to be perfect. We claim to care. And if we just bring everybody together and say, this isn't going to be easy, but we can manage this, and you're going to walk away knowing how to advocate for your kid
Mhm.
when I'm not there.
We're going down
Yeah.
an interesting path here in terms of you are both mothers, and I'm curious, what skills were your children able to pick up on their own without help compared to the children that you work with professionally?
Oh.
All of
I
the
mean,
prerequisite
it's,
skills to give them a first language.
yeah,
Mhm.
you don't have to, really difficult thing, and it's, I think this is what pains me so much in this realm of ASD, where typical parents compare their kids all the time. And it's not a fun thing sometimes. Like, parents compare their kids to other, like, parents will boast, parents will say, oh, my kid did this, my kid's on the track team, my kid did this. But they all have learned, despite actually education sometimes, despite what's in their home, they actually pick things up from other peers, from television, from reading. They naturally have the ability to pick things up from their environment. Do they need some help? Yes. But we're talking about a neurodevelopmental disorder where for many on the spectrum, none of learning comes easy. And so it's really hard for me. It's really hard because I know that parents struggle, and I know parents struggle with children who are very complex. And I know equally well parents struggle with children who are very, what some people call high functioning, less need. But the needs are different. The needs are all different. And that's what spectrum means. It doesn't mean high to low. Spectrum means the symptoms are different in every single individual, which makes every child unique, every individual unique, and not easier or harder than somebody else.
Yeah.
But I think what's difficult for some parents is when, in media and in movies, typically those more able individuals are depicted. And that's not the reality for a lot of our families.
That was a rather impertinent question for me to ask, and it also sort of pulled us in another direction, which maybe I shouldn't have done. But what I think about in my child's early years, when he was 3-4 years old, there was a stark difference between my boy and other kids his age. And I can think of looking at, for example, a parent of neotypical children just walking down the sidewalk and never looking back to see if the kid's going to follow them. And not because they were crap parents, but because they knew the kid was there. And so they could be looking at their phones, they could be fishing through their wallets, it could be, and there would be cars and dogs and all kinds of things going on. And I had a child that I would never let go. I had to hold on to him with one arm for many years and do everything with my left arm. So there's this huge difference. And we at the OAC, we're trying very hard not to tell parents what to do, because we're involved with this fight to bring funding back to families who need it. How do we convey that if you have one of these kids with high needs, that you need to get your butt down to a center? You need to get your butt over to talk to Tracie, to talk to Alali. And how do we do that? So I was trying in a very clumsy, sneaky way to get you to describe the difference between, your neurotypical children and, say, your clients. But here I am floundering because I pulled you in a direction without.
Yeah, I think it's about need, right? It's about, like Lolly said, having that really good assessment. And like I always said for parents who came to our center, if you're not sure, don't sign up for services long-term. Get a full needs-based assessment. Find out from the speech pathologist where your child is functioning, from the occupational therapist, from the behavior analyst. Get that prescription for your child's next few years. From the professionals, from the people who are actually trained to know how far away from that chronological age is your child functioning? What do we prescribe in terms of intensity? Because that's what professionals are trained to do. In some, yeah, Lily, go.
I was just going to say something a little bit different, that we have two options. We have school and we have therapy, right? Those are our two options as parents. And if you look at the research, if you listen to the experts, everybody's saying early intervention, early intervention, early intervention. Let's get your kid caught up to a place where they can successfully function in a school environment. School isn't going anywhere, right? You have many options. In therapy right now, unfortunately, there aren't, and the options are getting slimmer and slimmer due to continuous funding cuts. And when we're looking at a child, if a child can't sit for more than 2 minutes, if a child needs constant supervision, if a child is likely to mouth a non-edible item, if a child, requires one-to-one support to color a piece of paper, we're talking like a little kiddo. Those are some really good signs that maybe we need some therapy before we go into an environment with 30 kids and 2 teachers, because it could take a significant amount of time for your child to get flagged, for some sort of support to get flown in. And then it all starts over again the next year. When you move into a new grade with a new set of teachers, so on and so forth. And so you really, as a parent, I want my child to be in a place where they can function in the environment in which they are spending the majority of their day. Days are long, years are short. And so how do we prioritize? It's really hard, right? Because parents get a diagnosis, the doctor says, go get this therapy. And then they speak to a whole bunch of people saying, well, now you can go to this person for this, and this person for this, and that person for this. I don't know how many sort of one-stop shops, quote unquote, there are to say, okay, we've got you. Let me get our SLP, let me get our OT, let me get our, and we'll do everything here for you. So I think that that's really a very clear message for parents. Our schools aren't going anywhere. Your child is in the system until grade 12 and then can continue into the system until they're 21. That ability to learn, right? And undo, let's say, maladaptive learning patterns. The longer you wait, the longer the therapy takes to be effective. Right? Because then we have to undo to do.
Yes. And that's a great point, Lolly, that the longer you wait, the harder it actually is. You've made every therapist's job that much harder because we're undoing some things that the child has naturally fallen into strategies trying to cope, but they may not be really helpful.
Parents fall into behavior change too, right? I'm exhausted. I can't function. When I hear that specific pitch, I better get that iPad out, or else I'm in for a 2-hour meltdown, right? It's their behavior change. There are ways that families cope. We all do it, right?
And I think one of the things that might be helpful for parents, and I know there's well-meaning, all these parents in the OAC especially are well-meaning. They're all trying to share what worked for them, and really make sure that somebody else gets that opportunity. However, I think as a family, as the parent, you actually have to be very open with every therapist you go to, because there are pros and cons to every therapy. There are limitations of every therapy. And so just make a good informed decision. So if you need articulation help, or your child's not intelligible or is stuttering, absolutely, speech pathologists can handle, that's what they handle. But if you go to someone and says, oh, I can do parent early intervention, so I can work on joint attention, social responding, early requesting behavior. But you have on the list, my child can't do any fine motor. They can't self-feed. They can't dress themselves. They're not toilet trained. They bear the gait, their gait is off. That perhaps program, even though it may be incredibly well-designed, evidence-based, have good outcomes, won't meet all the needs if that is your child and those are your needs. And so you have to be really clear and ask those hard questions. of every therapist, of every clinician you go to. What does your program do? What do they not do?
And how
What
can
does
your
it
child
not teach?
flow through
Yeah.
your program, right? Do you offer one service and then once my child sort of, is done with that service, we have to find somewhere else? Or do you have a flow of service, right? That my child can grow with until they're ready
Or will you
to
bring
enter
someone
their
in?
Yeah.
Will you gain, additional knowledge? If my child needs a speech generating device and nobody at your center is trained in it,
That's right.
can I bring someone in, who can help? And so I want to stay here, but there are additional needs. The one thing about autism spectrum disorder is there is no one provider that has the full scope of practice that can treat every single part of that child. There isn't one person. And that's why you need teams. That's why you need a physician. May need a social worker. You have the parent, speech pathologist, occupational therapist, psychologist, behavior analyst. All of the strengths come together to look at everything. The other thing is it's about a relationship. And I'll be the first to admit behavior analysts have not done this well. And we're working on it. But like Wally said, she's a teacher, so she knows about relationships. Speech pathologists know about relationships. We have parents who come daily, all day, every day we have their children. We need to build the relationship with the family. We have a unique setting, a unique opportunity to do that other therapists don't have.
So there are parents who are a little bit grumpy about experiences that they've had at behavioral centers. Is that possibly why that the BCBA has not developed that relationship with the parent that you're describing? Like you said that some behavioral therapists are not good at that. So what are they not good at? I mean, they're the behavior people, right? Shouldn't they be good at that?
Yeah, it's one thing to be trained in with children and pediatrics and knowing what I do. And honestly, behavior analysts are very focused on changing the behavior of their client. And sometimes they don't realize, like Loli has said so eloquently, that it's the whole family that's your client. And you have to bring them along. And it could be, Karen, honestly, I've run I don't even know how many centers now. It could be everything from the rules were too rigid because the center is large and you need structure and you need organization like schools have. We couldn't be flexible to take your child, on your way into Toronto at 6:30 in the morning. There's all kinds of little things that it may just not have been a good fit. You don't actually fit with everybody.
I've got my head back on. And with our last 10 minutes, I want to ask you, we did a lot, Tracie and I had a very, I think, valuable discussion about her work as a speech and language pathologist and as a BCBA and how she marries the two and how these two different backgrounds inform each other in her work. Lolly, you've referred to using SLPs and OTs and bringing them into the center and collaborating. Could you talk a little bit about those collaborations? And I'm curious to know two things. I'm curious to know about what you learned from having an SLP or an OT collaborating with the team, and also what have they learned from you in collaborating with you? Do either of you want to talk about that?
Sure. I mean, I think collaboration is paramount. We have collaborated from the get-go, so it's been just about 20 years of collaboration, and I think I've been lucky enough to have met some tremendous professionals, early on in the game, and to learn from them, to watch them work, for them to watch me work. Back in the day, it was an SLP and myself in a home with a student. And we would work together. And once the SLP would give me their targets, I would say, okay, here are your language targets. Now let me see how I can embed these targets into our ABA program so that this 1 hour session and the targets that are focused on in this 1 hour session can now be worked on across the week, so that when the SLP comes back, she or he may determine whether they're ready for, their next skill. I have learned, oh gosh, a tremendous amount. Everything from, let's talk about occupational therapy. I feel very confident in our early intervention division with our kindergarten classrooms and preparatory classrooms, that when a kiddo has, needs support with writing, I've got it down. I don't have to tell the parent right from the get-go to say, yep, you need to get an OT in here to do an assessment, 150 an hour or whatever it is. I'm going to say, no, first we're going to start with our slant board, this type of, I just hit myself, this type of pencil. We want to put, the elastic band at this point, make sure that they're 90 degrees. Is their chair the right height? Is their table the right height? Go, 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 go. Right. And then we'll check back in a few weeks. We'll see the gains. Okay, great. What's the next thing? And we work that way until we hit a point where I say, I don't know, we need to call in an OT. I'm not sure. So I think that, just being open to collaboration and listening to other professionals' areas of expertise, and more importantly, passion. I think I try and find those people in my life, the people who are just so dang passionate about what they do that you see it in their eyes. Like, I've got one OT and one SLP, and somebody else that I just look at them, I'm like, after 40 years, you love what you do. I met you 20 years ago and you still have the same passion. Can I say it? Can I say her name? Because she's incredible. Am I allowed?
Doesn't bother me.
No,
Yeah.
Paula Killa. She's just absolutely incredible.
Yeah.
But what have they learned from me? I don't know. You got to ask them. I hope a thing or two about, how to get a kiddo ready to start a session. And but it's been a ride. It's been incredible. I've had some incredible mentors, and I've done the best that I can to pass that on to our staff, whether it's, having Carbone coming to the center and doing a 3-day workshop, or whether it's just ongoing training that our STs or myself do with our staff, or if it's just on-floor supervision where staff are asking questions right off the cuff. Our SLPs and our OTs do all sessions with our therapists. They write notes, we embed into programs, and we collaborate. We work together. I had an OT say to me, oh, so it's not sensory, it's this. I said, 100% it's that. She's like, okay, great, checking that off my list. Let's move on to the next issue. So just, I think really beautiful. It can really be a beautiful marriage when you find the right people. And as a parent, it's exhausting. It's very confusing. But there really are two streams. There's therapy and there's school.
Tracie, how have other specialists you've brought in informed your work?
Oh, I mean, the same thing. I got into the field because I actually worked, within an ABA center as their speech pathologist. And I always loved children with autism. I mean, they're always the group that I worked with right from the beginning, but because it was, I have to figure this out. I have to figure this out. Like, somebody has to figure out how to teach them to communicate. And so that's what I got started. But that therapy center, that ABA center was phenomenal. I had never experienced the ability to go in and help them with a problem they had, like Wally was describing, and then model for them how they should do it, pick the targets that they need to work on, and then come back in 1 month and it's totally mastered. And I'm on to the next one. And it was like, I had never seen such precision. I had never seen such analysis of data, like the error analysis, and they would say, okay, well, we did what you said, but then we ran into this problem here, and look at this data and we tweaked this. Or I get an email saying, okay, we've run into this problem and, we need you back. And it was like, oh my God, it was like speech pathology on steroids. Like, I just saw so much more in outcomes than I ever got myself. And it taught me how to write goals better. It taught me how to break things down better. It taught me about what motivation was, and that my little stickers that, little Susie down the street loved for articulation. Yeah, this child was having no part of it. Like, there's just no way. And so it wasn't a motivator. It wasn't a reinforcer. It really taught me how to handle the behavior. Because as a private practitioner, when someone is paying you money to make changes in their child, and you can't handle the behavior so that you can't even meet your goals for that session, it causes a lot of anxiety. And I spent many, many years as a speech pathologist owning a private practice, being anxious every session because I didn't know how to handle this type of behavior. We didn't take it. And I learned so much from the field of ABA about that. So much.
I'm going to say something quickly, and it's a bit sort of offside, so stop me. But I know, we have been talking about young learners and early intervention. That's not to say, that ABA doesn't work at other ages and stages. And when, I have a very unique experience that I'll quickly share. My brother is also in the field with me. Both of my parents at different times, unfortunately, needed significant help. My mom was diagnosed with early onset Alzheimer's at 50, and my dad got into a catastrophic car accident, 15 years ago. And, both of my parents required intensive intervention from SLPs and OTs. And I didn't realize it at the time. You're so cute. Hi, guys. I didn't realize it at the time because you're just go, go, go when you're in it. But now that I look back, it was so easy. It was so easy for me and my brother to sit down and to say, okay, my dad got into a catastrophic car accident. So he had OT and SLP for 3 years. And I said, okay, so my brother and I would sit down, look at the goals, break them down, and we would embed them into his daily tasks. People or clients who were at our old center would remember that part of his therapy was fixing things. He was very good at construction, but after his accident, he couldn't put together a 4-piece puzzle. And so I think he's behind me. Oh, he's behind me.
Yeah, Dad.
So he's saying, thank you. Tell everyone. But no, he couldn't. And so as part of his therapy, I would lie and I'd say, I need you to fix the shelf up here. And we would take the goals from OT and SLP and embed them into daily life. And you just heard him in real life.
Voila.
He's great now, And, same for my mom. She unfortunately required 2 PSW. She's in a wheelchair. She can't feed herself. She no longer speaks. And I had a really big problem with 2 big men. I'm 6 feet tall almost, guys. And I look like my mother. So you can imagine she's no light woman. And she used to have 2 big men turn her over to change her. And I said, oh, no, I can't do this. And so Jesse and I sat down and we put together task analyses, and we went in there and we trained her PSW, and we trained the PSWs on her floor. And my mom currently does not need anybody to have hands on her at any point. So she went from needing 2 strong men to just do basic tasks to needing nobody to touch her. And so, quality of life is pretty incredible. And this science does it, in so many areas of life. It's pretty spectacular when you find the right people, right?
Yeah.
You find the right people.
I have a whole other side outside of pediatric ABA and SLP, and it's adults who've had stroke.
Yes.
And so we devised an intensive ABA plus speech intensive rehab program, and the results are incredible.
Yes.
Incredible. And that came from the field of ABA, actually.
Yes.
I mean, my training is from speech pathology for stroke and aphasia, but the reality of change
the
in an adult
that's right.
came from ABA.
That's
and
right.
there's way more research in the field of ABA for aphasia and stroke than there is in speech pathology. And it was like, that was a huge aha moment for me. Like, oh my gosh, you can apply this to any disability, any problem, any injury, acquired brain injury, traumatic brain injury, like you said. Yeah, it's about adapting environments and changing environments to change the behavior of the individual. And it's for quality of life. It's for socially significant reasons. We are not here to change. In fact, I have no idea how you change a personality. We are not fundamentally changing these people because I don't know how to do that. I'm not changing behaviors they don't want changed. Just like, if someone wants to work on my wine drinking habit in this pandemic, I'm not having any part of it. So, we only work on things that are going to be socially significant for that individual, for their family. And it is quality of life. It is. As soon as I heard about ABA, I took out a critical illness policy and said, this money, if I have a stroke or an accident, get me intensive ABA, because I want my quality of life back. And so I think that's what people aren't understanding. It is not an autism therapy. It is not.
Yes, yes. Well, we've hit an hour, and this was a delight. I wasn't sure how many directions we were going to go in tonight. My hope was that new parents or newer parents will discover this conversation, that person who's wondering, well, what is this? Which was me a few years ago, and going, who are these people? I never heard of this before. I Googled it, and I see a whole bunch of people saying that this is dangerous, this is damaging. Okay, so of course that's very, whoa, that, talk about anxiety, right? When you have a child with a lot of needs and someone says, don't do this, but the doctor says, do this, So the Facebook Lives are designed to bring people to the community that they may not ordinarily have access to. And I thank you for your time. Can you give me some advice? As an OAC representative, I stick my big, stupid, fat face on this Facebook page all the time. And I do advocate for saving services like the ones that the two of you run, as well as lots of other stuff. I think people should have what they need, full stop. Whatever that means to you and your clinician, that's what you should have. So when I'm confronted with a parent who's asking me for advice, and I never give it, by the way, but if they say, I hear ABA is abuse, what can I say? That doesn't sound like I'm selling them something, because I'm not. I'm just a mom from Scarborough whose kid needed intensive care.
I think that if that is the camp you're living in, find a team that brings you in to be part of that team, because it is only when we know better, we do better. And more information is always good. If your child isn't cutting it at school, if you are unable to manage the day-to-day of dinners and evening routines and life, and everything feels like an uphill battle, and everything feels stressful, and that you're not getting the support where your child currently is, find a provider, find a center, find a team that says, you're welcome anytime. I think our parents know pre-pandemic, can't wait for this to be done, that there's no appointment needed. Parents come in, grandparents come in, parents come in. Okay, your kid's in that room. Okay, go, just, don't disrupt. Go do what you need. And I know, and I'm not saying that that's the only way. It's there are many ways that centers operate to allow for transparency. But I think that if you're in that state, right, assumptions are never on the good path, right? When we're always assuming the worst. And I think the only way that you can break that is seeing is believing.
Yeah, I think that abuse, I think what's different about ABA and the claim that it's abusive is twofold. Number one, it's painted perhaps a situation or a provider, a certain person, and how they applied the treatment or the science. It's painted the full field with that same brush. So, and it's kind of, and because people don't have daily experience with ABA, they don't have their own experiences to draw in. So it would be like saying, oh, don't go to the dentist. I had a dentist that killed me. Like he did, the root canal was wrong. It's abuse. No more dentistry. And everybody would look at you and laugh because people have gone to dentists. It's a daily part of your life. It's not daily, but a couple times a year you go. So you've had enough of your own experience to know, wow, buddy, you did not have the right person. Please go see my dentist. He doesn't do those things. But you're not going to say, oh, dentistry is evil and it's abusive. So you have to tease that apart. You have to actually get enough information to know, wow, if it really was abuse, that is horrific. It needs to be dealt with. That person needs to be reported. We have standards, just like every other health profession, that can't continue. Same with what's going on in some schools right now with bullying. We know bullying happens in schools. We hear about it on the news, but people don't say no more education. It's abusive, right? It's like, no, we need to find those specific individuals and those specific instances, and we need to stop those because we know the positives of those services. And so it is hard because you don't want to just say, well, yeah, that's not true, because it very well may be true. And as a field, we're trying to do better too by listening to people who have had services and really talk about it. The field changes. It's a scientific field. It's like medicine. I'm pretty sure if you put someone through a lobotomy or bloodletting nowadays, you'd be up on charges. But that's what medicine was not so very long ago, actually. Right? And so it's evolved and changed and it gets better. And so as a field, we have, there is such, in my training anyway, there was such a focus on positive reinforcement-based change, not punishment. And even the definition of punishment, like we do use that term sometimes because saying no to someone is considered a punisher. If it changes their behavior and it stops their behavior or lessens the behavior, it was a punisher. Well, like most parents use punishers daily with their children. That's just life, right? And yet we wouldn't be called abusive. And so I think it's understanding the field too. It's really being that partner to bring you along and to help you understand what this is and what to be cognizant of, what to watch for. If your child is running into that center and doesn't want to leave at the end of the day and they're happy and they're asking for school, I don't know if you have much to worry about because that's like every parent's dream. So, again, parents know their children. They know the signs to look for. And as a mom, when something's not right. And so trust your gut. Trust your gut. There's no shame in saying, I want to give notice. It's not working for our family or me. I'm going to try somewhere else.
Well, what an hour. What a wonderful, wonderful hour this has been. I would love to continue this conversation and fold in other professionals if you're willing. I hope that parents will find this, and we'll leave it up on the site. We'll put it on our YouTube page. There's so much to talk about when it comes to the work that you do. And I thank you for your time, both of you, for being so candid and sharing a little bit of your personal lives. I know that's not generally what professionals do. It's what I do. I try to get people to talk about who they really are and let the community see that, because we really are a small family. Therapists, families, teachers, all combined. We really, truly are. And I'm grateful to know you both, and thank you for your time. I have so many more questions, but I hope that no, shut up, Karen. I do have so many more questions that I want to ask you. So would you agree to a part 2? Or we could talk a bit more about centers and individual ITs, instructor therapists, and what they do and how they do it.
Said, I'm going to pop on. I was like, I don't think you can do that. You don't have the Zoom link.
Yeah.
Yes, that was a conversation that I did want to have. I did want to speak specifically to the people who do the heavy lifting and not the bosses, because I think they have an interesting perspective. Maybe I can get some of those people to agree to do a Facebook Live. I hope so. So thank you. I'm sorry that I stalled so much in my brain. It's just that there are so many things I could ask you. And that's it.
Part 2.
Part 2. Could we do a part 2?
We could do a part 3.
We could do, okay. Thank you again for your time, ladies. A
You're
great
welcome.
pleasure. Okay. Good night.
Okay.
Shut up, Karen. Good night.
Good
Good night.
night.
Good night.
Good night. Good night, Lolly. Good night,
Bye.
Karen.
Good night.